They call them routine checkups, but for women over 70, some of these tests could do more harm than good. You're told it's about prevention, that more screenings mean a longer, healthier life. But what if I told you there's a system quietly pushing unnecessary tests that carry hidden risks? We're talking about radiation exposure. It's false positives that lead to intense anxiety and even dangerous treatments that were never needed in the first place. The scary part? Most older women never hear this side of the story. Instead, they're pulled into a cycle of tests, worry, and repeat procedures. Symptoms like chronic fatigue, anxiety, and even organ damage can be triggered by the very tests meant to protect you. In fact, one study revealed that up to 42% of older adults received at least one unnecessary test that led to avoidable harm. In this video, we'll reveal 5 health checkups that older women should think twice about. We'll rank them from least to most dangerous, and you'll want to stick around for number 2, because it's a test that might just double your risk of cognitive decline. Before we dive in, let me ask you, have you ever wondered why some tests leave you feeling worse than before? And are you curious about what the latest medical research says about the tests you should actually be getting after 70? Let us know in the comments below. We're reading every single one. All right, let's start with number 5. Trust me, this is one your doctor probably won't warn you about. Number 5 is bone density scans. For many women over 70, these scans, also called DEXA scans, are a standard part of a checkup. They're meant to detect osteoporosis, a condition where bones become weak and brittle. That sounds helpful, right? But the reality is much more complicated. By the time a woman reaches her 70s, it's completely normal for her bones to show some loss of density. Here's the catch. Many of these natural changes aren't dangerous enough to require medication. A report in JAMA Internal Medicine found that over 60% of women over 70 diagnosed with mild bone loss were given strong medications with serious side effects, like jaw decay and esophageal ulcers. The shocking part? Most of these women were never at a real risk of a fracture. That's because these scans compare your bones to those of a healthy 30-year-old. It's like comparing the skin of a 70-year-old to a 30-year-old, calling the difference a disease. It just doesn't make sense. Studies show that women over 70 with no history of fractures have a very low risk of a hip fracture. So if you're past 70 with no broken bones, it might be better to skip the scan unless you had a recent fall or noticed changes like shrinking height. Instead, a tool called the FRAX score can give a more accurate picture of your real fracture risk by looking at multiple personal factors. And here's the little-known fact. Gentle resistance training 2 to 3 times a week can improve bone density by up to 6% in women over 70. No scan needed, just movement and good nutrition. Coming up next is a test you've probably had every single year, but it could be quietly doing more harm to your kidneys than you realize. Number 4. Annual blood panels that can hide dangerous kidney damage. Most older women are told to get these blood tests every year. They check things like cholesterol, blood sugar, and liver function. These are all important, but there's a specific part of this panel that often gets misinterpreted in seniors: the kidney function test. This test measures a substance called creatinine, and a high level can signal kidney problems. The problem is, as we age, we naturally lose muscle mass. Since creatinine is a waste product from muscle, older women often have lower levels, which can make their kidney function look better than it actually is. So, a result that seems normal might be masking underlying kidney decline. This is incredibly dangerous because many common medications, like certain blood pressure pills, and even over-the-counter pain relievers like ibuprofen, can harm the kidneys. If your doctor thinks your kidneys are fine based on a misleading test, they might prescribe a medication or a dose that could silently damage your organs over time. This can lead to chronic kidney disease, a condition that's often irreversible by the time it's caught. One 78-year-old woman we know, Sarah, was taking high doses of a common pain reliever for her arthritis. Her annual blood tests always came back normal, but she was feeling more and more tired and swollen. A more specialized test revealed she had stage 3 kidney disease. The normal creatinine level had masked the damage for years. So what's the alternative? Instead of relying only on creatinine, ask your doctor about a test called cystatin C. It's not affected by muscle mass and gives a much more accurate picture of kidney health in older adults. This simple switch could be the key to protecting your kidneys from preventable harm. Remember, a test is only as good as its interpretation. Don't be afraid to ask for a more precise measurement. Thanks for watching so far, if you're finding this helpful. Are you a woman over 70? Or do you have a mother or grandmother in that age group? Then you need to hear this. Routine medical checkups, the very things meant to keep us safe, can sometimes hide serious dangers, especially for older women. Today, we're exposing 3 common tests that are frequently overused and could be doing more harm than good. Let's start with a test almost everyone gets: the routine blood panel. When it comes to aging kidneys, these standard blood tests can miss the real danger and sometimes even make things worse. It's one of the most common markers doctors look at is serum creatinine. It's a waste product your kidneys filter out, so they use it to estimate how well your kidneys are working. But here's what they often do and tell you. Creatinine levels are heavily influenced by muscle mass. After 70, women naturally lose muscle, and this can make their creatinine levels look perfectly normal, even when their kidney function is already declining. This means older women might be walking around with stage 2 or even stage 3 kidney disease and have no idea. A 2022 study in the Clinical Journal of the American Society of Nephrology found that these standard creatinine-based tests missed early kidney disease in over 35% of women over 70. Researchers are now urging a switch to a more accurate marker called cystatin C, which isn't affected by age or muscle mass. Now, here's where it gets even scarier. When these standard panels give a false sense of security, doctors might prescribe medications that are toxic to the kidneys, like certain anti-inflammatories for arthritis or some blood pressure drugs. Without realizing the kidneys are already vulnerable, this can push someone into a rapid decline. That's exactly what happened to Donna, a 76-year-old retired teacher. She was active, walking 3 miles a day, but came in complaining of fatigue and swollen ankles. Regular blood panel 2 months earlier had been normal. But when we ran a cystatin C test, her kidney filtration rate was only 44, indicating stage 3B kidney disease. This explained all her symptoms. We immediately stopped a medication that had been quietly straining her kidneys. Within 2 months, her energy returned, the swelling went down, and her kidney function stabilized. If you're over 70, especially if you're thin or have lost muscle, ask your doctor for a cystatin C test. It's more reliable and has been recommended by the National Kidney Foundation since 2021 for elderly patients. Next up, a scan that's been marketed as a lifesaver, yet may double your risk of memory loss after 70. This is where things get even more shocking. Number 2, CT angiograms. As we age, doctors often recommend heart checkups. One very common test is the CT angiogram. It uses a contrast dye to create a detailed image of your heart's blood vessels to check for blockages. But when used to freely in older women without clear symptoms, this test can quietly cause harm. First, that strong contrast dye has to be filtered out by your kidneys. And as we just discussed, aging kidneys are often more fragile than they appear on paper. If they can't clear the dye properly, it can cause acute kidney damage. But the bigger concern is for your brain. A 2021 study published in the journal Stroke found that older adults who had multiple contrast scans within 5 years had nearly double the risk of developing vascular dementia. The dye can sometimes trigger tiny clots or alter blood flow in the brain's fragile vessels. The damage builds slowly over time, starting as simple forgetfulness and progressing into something much more serious. Think about Teresa, a 79-year-old patient. She had 3 CT angiograms in 4 years for mild chest pressure that turned out to be just from being less active in winter. Her arteries were clear each time. Months after her last scan, her family noticed memory lapses and mood swings. We reviewed her history and found no other risk factors for cognitive decline, but those repeated contrast dye exposures stood out. We helped her recover some function, but the damage was done. So when are these scans actually needed? If you have clear signs of a serious heart problem, like chest pain at rest or fainting, a CT angiogram may be necessary. But for stable patients with vague symptoms, safer alternatives exist. A treadmill stress test or a coronary calcium score, which is a low-dose CT scan without contrast dye, can assess heart risk without threatening your kidneys or your brain. The worst part is that many women are never told about these alternatives. Next, we'll reveal the #1 most overused test in older women. Hey everyone, and welcome back to the channel. Today we're diving into a topic that might really surprise you, especially if you're a woman over 70 or have a loved one in that age group. We're talking about routine pelvic exams. The manual check of the uterus, ovaries, and vaginal canal. Millions of women over 70 still get these every single year, even when they feel perfectly fine and have no known risk factors for cancer. But here's the thing. Is it actually necessary? Back in 2017, the U.S. Preventive Services Task Force looked into this, and their recommendation was pretty clear. They found no solid evidence that these routines, exams in asymptomatic women, actually reduce cancer deaths or improve health outcomes. In fact, they can sometimes cause real harm. So, how can a simple exam be harmful? It often comes down to false positives. That's when the exam finds something that looks abnormal but isn't actually dangerous. But once that flag is raised, it can trigger a whole chain reaction of follow-up tests, ultrasounds, biopsies, and sometimes even major surgeries. And every single one of those procedures comes with its own set of risks. For older women, these risks are even greater. Age-related thinning of vaginal tissues can make the exam itself uncomfortable or even painful. There's also an increased risk of infection after procedures, and healing just takes longer as we get older. A study published in the Archives of Internal Medicine found something truly striking. It revealed that 63% of women over 65 who had a routine pelvic exam ended up having at least one follow-up test that ultimately found nothing significant. Think about that. Nearly 2/3 underwent extra procedures for no reason. What's worse, many of these follow-ups uncover what doctors call incidentalomas. These are small, benign growths or cysts that would likely never cause any symptoms or shorten a person's life. But once they're found, they create a huge amount of anxiety. Patients and doctors can feel pressured to do something about it, even when the best course of action is simply to leave it alone and monitor. Let me tell you about Eleanor. She's a 75-year-old former chef who shared her story with us. She went for her routine checkup, and the pelvic exam detected a small ovarian cyst. Her doctor then ordered an ultrasound, which was followed by a CT scan. Finally, the recommendation came: surgery, just to be safe. Eleanor was terrified of cancer, so she agreed to the surgery. The result? The mass was just a harmless, fluid-filled cyst, which is actually very common after menopause. The surgery wasn't harmless. She spent 5 days in the hospital dealing with complications and then needed 6 long weeks to recover from an operation that she never really needed in the first place. The emotional toll was just as heavy. She told us she felt like she was a ticking time bomb, only to find out there was never any danger at all. Her story is a powerful reminder of the potential downsides of overtesting. So this brings us to the big question. When is a pelvic exam actually necessary for an older woman? Well, if a woman has specific symptoms, things like pelvic pain, abnormal bleeding, or a feeling of pressure, then the exam becomes a very important diagnostic tool. It can help doctors figure out what's going on. But for women who feel perfectly well, have no complaints, and are not at high risk, the evidence suggests that the routine annual pelvic exam may offer more potential for harm than good. The key here is to have an open conversation with your doctor. Talk about your personal health history, your risk factors, and the latest medical guidelines. Don't be afraid to ask questions like, why is this test being recommended for me? And what are the potential risks and benefits? Ultimately, the goal is to make an informed decision that's right for you. It's about moving away from a one-size-fits-all approach and toward personalized, evidence-based care. Let's talk about the #1 most aggressively promoted medical test, a procedure that might quietly be harming memory, gut health, and even raising your risk of sepsis, especially in seniors, and almost no one is warning them about it. I'm talking about colonoscopies for people over the age of 70. Now, we all know the colonoscopy is described as the gold standard for cancer screening. It's recommended everywhere, marketed heavily, and often feels like a routine rite of passage once you hit 50. But here's the thing. By the time you reach 70, especially if you've had clear screenings before, this test can start doing more harm than good. So what happens during a colonoscopy? A flexible tube with a camera is inserted into the colon to look for polyps, which are small growths that could potentially become cancerous. But to do this safely, your colon has to be completely empty. This means drinking a powerful laxative solution, and this is where the problems for older adults can begin. That PrEP solution is incredibly dehydrating, flushes out your entire digestive system, getting rid of not just waste but also essential electrolytes and the beneficial bacteria that are crucial for gut health. For older adults who already have lower hydration reserves, this rapid flush can lead to dangerous drops in blood pressure, put a strain on the kidneys, and cause serious electrolyte imbalances. A 2016 study in the American Journal of Gastroenterology found that nearly 28% of patients over 70 experience moderate to severe dehydration after their PrEP, leading to fatigue, dizziness, and sometimes even hospitalization. But the bigger danger can come afterward. Your colon is home to trillions of bacteria that make up your gut microbiome. This is a complex ecosystem that supports your immune system, balances hormones, and even affects brain function. A colonoscopy, especially if a polyp is removed, can disrupt this microbiome for weeks. This weakens the gut barrier, the protective lining that keeps harmful bacteria from entering your bloodstream. If that barrier fails, it can open the door to sepsis, a life-threatening, body-wide infection. A 2019 report from BMJ Open found a shocking statistic. Older adults had a 12-fold, an increased risk of hospitalization for sepsis in the 10 days following a colonoscopy with a biopsy, compared to the general population. Many of these cases were in people who had zero prior symptoms and were just getting the test as a preventive measure. Then there's the anesthesia. Most colonoscopies use sedation to keep you comfortable. But for adults over 70, especially those who might already have some cognitive vulnerabilities, anesthesia has been linked to short-term delirium and even long-term memory decline. This isn't just a minor side effect, it can significantly impact quality of life. Now, let us pivot for a moment to another area of concern for women's health: ovarian cancer screening. For years, the standard approach involved invasive procedures if there was any suspicion. But a more symptom-guided strategy is gaining traction, where exams and scans are only done when there's a clear reason. If imaging is needed, a transvaginal ultrasound can provide incredibly detailed pictures with much less discomfort and risk than older methods. Plus, newer blood tests like the CA-125, while not perfect, can help doctors evaluate risk without immediately jumping to invasive procedures. The key takeaway here is that medicine isn't one size fits all, especially as we age. What's considered a gold standard for a 50-year-old might carry unnecessary risks for a 75-year-old. It's so important to have open conversations with your doctor, to weigh the real benefits against the potential harms. Did you know that after a routine procedure, 41% of seniors can experience cognitive changes that last for at least a month? This isn't just a statistic, it's a reality for people like Joan, an 81-year-old retired piano teacher. After a colonoscopy her new doctor insisted on, she developed a severe infection and was hospitalized. Even after she recovered, her daughter said she was never the same. Her memory faded, and her love for life dwindled. And the worst part, the test found nothing. So when is a colonoscopy actually necessary for older women? Well, if you're over 70 and have never been screened, or if you have concerning symptoms like rectal bleeding or unexplained anemia, the test can be a lifesaver. However, for women who've had negative results before and have no symptoms, major guidelines actually recommend stopping routine screenings, especially if your life expectancy is under 10 years. There are safer, non-invasive options, like the at-home FIT stool test. Detects hidden blood and has a high detection rate for colon cancer, without the risks of sedation or harsh PrEP. This brings us to a crucial point. 5 common health checkups for women over 70: bone density scans, routine blood panels, CT angiograms, pelvic exams, and colonoscopies can sometimes do more harm than good if they're just done routinely. Each test has a place, but it must be used wisely, based on your individual health, not just because it's on a checklist. The best medicine isn't a machine or a test. It's personalized care and an open conversation with your doctor. Now, we want to hear from you. Have you ever questioned a recommended test or procedure? What was the outcome? Share your experience in the comments below. Your story could help someone else make a more informed decision. We're reading every comment and we'll reply with personalized advice. Thanks for watching, and don't forget to subscribe for more insights on aging well.